Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. You can make use of it. So now we are discussing about certain clinical aspects related to the doshas. In the last class we have seen Shaitya and as well as Supti, whereas and also we have seen Stambhana caused by Vata and Stambhana caused by Kapha. So today we will see another set of symptoms, that is Pitta and Vata. Okay, so now you take one important guna which we commonly use, that is a Lagu guna, isn't it? So Lagu guna, Pittam Sasnehat Tikshnoshtam Lagu Visram Sarandravam. So Lagu guna is seen in case of Pitta and also in case of Vata. Tatra Ruksho Lagu Shita. Okay, so in Vata guna, so Vata dosha also contains Lagu guna and Pitta dosha also contains Lagu guna. Now clinically, when Lagutva occur in the body, how to differentiate whether it is because of Pitta or whether it is because of Vata? Okay, now let us discuss about that. Lagu guna of the Vata is due to Vayu and Akasha Mahabhuta. When I talk about Lagu guna in Vata, so because Vata is made up of Vayu and as well Akasha Mahabhuta. Whereas Lagu guna which is present in the Pitta, it is not because of Akasha and Vayu Mahabhuta, it is Lagu guna of the Pitta is attained because of the Ushna guna of the Agni. Okay? Okay. Agnireva Sharira Pitta Antargata. So Agni is present in the body in the form of the Pitta. So that is the Ushna guna of the Agni. So that has been represented as Lagu guna when we talk about Pitta. Okay? So now that means Agni is always moving upward, isn't it? Urdhvagamana. So therefore, naturally, anything which is Lagu, that will move upward. Okay. So therefore, in Pitta also we will have the Lagu guna. Okay. So now Agni, when we talk about Agni, Ahara etc. is digested very rapidly. Okay. So when Ahara etc. whatever food we consume, that is digested very quickly. So it leads to the Lagutva of the Lagutva. It leads to Lagutva in the Pitta. For example, Atyagni, Basmaka Roga. Okay, so that means in Atyagni there is more Agni will be there. So whatever you take, that will be get digested very quickly, burnt out. Okay, so that means that Ushna guna is causing that particular Lagu guna. Okay, so in such conditions, what you have to give? You have to give the Guru Ahara. Patient suffering from thyrotoxicosis, patient suffering from Atyagni, patient suffering from or Basmaka Roga. In such conditions where we have to go for Guru Ahara, Mahisha Dudda, etc. should be given. Okay, or Shita Dravya should be given because we want to combat the Lagu guna of the Agni there, Lagu guna of the Agni. Whereas Lagu guna which occurs in Vata, that is different. Lagu guna which occurs in Vata, the movements takes place easily with coordination, then it is Lagutva. In relation to Vata dosha, when I talk about Lagu guna, it means that it is the bodily movement which is taking place very smoothly and comfortably with coordination. So then it is called as Lagutva. Deha Indriya Lagutva. Lagutva means, so in the body, if there is excess, therefore one thing is very clear. In the body, if there is excess movement is there, okay, suppose there is excess movement is there in the body, so that means that Lagu guna is increased. Lagu guna of the Vata is increased. One of the best example is Kampavata. In case of Kampavata, okay, there is excess movement is there. So that suggests that the Lagu guna of the body is increased in excess. There is no coordination. If it is normal, there will be coordination. Now it is above the coordination. It is increased above the normal level, and as a result, it leads to Kampavata or intention tremors or this working. The resting tremors or intentional tremors, etc. Okay, so this is how you have to understand Lagu guna in relation to Vata. Lagu guna in relation to Vata, because of the normal amount of Lagu guna present in a Vata, it helps for the normal functioning of the body, easy movement of the bodily tissues or whatever the elements in coordination. But when in excess, it leads to a problem like Kampavata. Okay, there is one more condition, that is called Kapha Avruta Vyana. Okay, Vyana is now Vata. Okay, it is Avruta by Kapha. So there will be Gati Sangha. So far we have discussed Lagu Guna means it helps for the normal movement. Gati Sanga will be seen in case of Kapha Avrta Vyana. Kapha Avrta Vyana. So because of Kapha, what happens? Gati Sanga is happening. There is ceasing of the movements. Okay, movements are get obstructed or seized. Why? Because it is happening because loss of Lagu Guna of the Vayu. Loss of Lagu Guna of the Vayu, etc. So this can be seen in case of Parkinsonism. Kapha, because of the Kapha obstruction, the Vata is get vitiated and Lagu Guna is get affected, and that leads to this kind. So this Kampavata and as well as this Parkinsonism. So these are the two examples where we can explain this particular Lagu Guna. Lagu Guna in excess and Lagu Guna in less. That means decrease in Lagu Guna and increase in Lagu Guna. Increase in Lagu Guna leads to tremors, etc. Okay, resting tremors, intentional tremors, etc. Decrease in Lagu Guna, so that leads to decrease in movement, as we seen in case of Parkinsonism. In Ayurveda, if you want to say, for example, Kapha Vrata Vyana, so where we find the Gati Sanga. So this is how we can understand these two important, this one particular quality of Lagu Guna in relation to Pitta and in relation to Vata. Okay, so in Pitta, when Lagu Guna increases means it is Agni increases, because the natural tendency of the Agni is moving upward, that is because of the Lagu Guna. Okay, so if the Pitta increases, the Lagu Guna in the body increases. So this is about this particular quality. In the next one we will see in the next class.